Hello, everyone. Welcome today. I'd like to pass my gratitude to James and his team at Live for Well for inviting me today to talk to you about this very important topic to me, how diet therapy reverses chronic disease. A little bit about me. I'm trained and certified with BANT, which is a UK-based government certification body for nutritional therapists, and also with the Institute of Functional Medicine. I'm one of 2 certified practitioners with the Institute of Functional Medicine in Hong Kong. This is a practice of medicine in the United States, and its philosophy is about reversal and bringing the body back to equilibrium, bringing the body back to normal, using natural methods which the body respects and uses. So it's a very popular methodology of treating people, especially in the United States, in the UK, and functional medicine is becoming more and more popular in Hong Kong. Okay, so let's go straight in. Okay, so a bit of statistics about what's actually happening in Hong Kong. So here we have the primary healthcare blueprint findings. And what it says is we have around 2.2 million people just a few years ago who have some chronic disease. And this number will reach 3 million people by the date of 2039. So that's actually quite significant group of people who are going to have a chronic disease. And in this blueprint, it's highlighted that those diseases are mainly going to be diabetes and hypertension. So keep that in the back of your mind when we progress. And when we talk about metabolism, what do we actually need? It's a very complex process, but I'll try and break it down very simply for you. So we basically need nutrients. We need key nutrients for our health. Obviously, it's carbohydrates, fats, proteins, oxygen, water, and last but not least, micronutrients, very critical. And this makes energy inside your cells, ATP, and the mitochondrial respiration of that. And then we need to eliminate the toxins and the breakdown products of energy production with urea and carbon dioxide. The ultimate goal is to make energy. But what creates a poor metabolism? And this is really into 3 key areas. So first of all is a sedentary lifestyle. Most of us, I presume, have office jobs. Most of us are sitting down 7, 8, 9, 10 hours a day. So that's quite sedentary. And especially in Hong Kong, what I see is that there's quite an excessive consumption of carbohydrate. So I'm talking about 2 or 3 carbohydrate categories here: rice, noodles, and anything to do with bread and pasta and that category. And then when you combine these 2 categories together, you create inflammation and stress in the body, which then drives the process of inflammation and diabetes. And here is a study, the globalization of diabetes just shows how bad lifestyle actually creates this really terrible disease. So we really have to focus on the lifestyle as the first intervention. And the core issue is actually managing the hormone which controls the glucose regulation in your body. So the hormone which regulates that is insulin. And when insulin goes too high in the body, because you're diabetic or pre-diabetic, you have what's called insulin resistance. And insulin resistance has more causes to any disease than anything else I know. So it's hardly tested. So if you look at all the conditions it's associated with, high blood pressure, diabetes, stroke, heart disease, obesity, migraines, there's so many associations with high insulin. And this is what we should be focusing on when it comes to chronic disease reversal. And here's a paper, Insulin and Aging. It says a disappointing relationship. Why is it disappointing? Because they say when your insulin goes up, you are going to age a lot more faster. So this is the hormone we should be focusing on. And let's look at the timeline of how you develop insulin resistance and diabetes. So you can see the blue line is the glucose. And over time, your glucose goes up and you get diabetic. But before you become diabetic, your insulin is going to shoot up first. And as the insulin shoots up, it's telling you that you are pre-diabetic. It's telling you you are insulin resistant. And this is when we should intervene to reverse that process. We shouldn't wait until we become pre-diabetic. So what is the problems with insulin resistance? Well, one of the first things it does, it creates chronic fatigue. And here's a paper showing the role of mitochondrial dysfunction in insulin resistance. So I mentioned earlier the mitochondria in the cells make your energy. So if the mitochondria are not making energy because you have too much insulin, what are you going to feel? You're going to feel tired. And this is why that's a common symptom for a lot of people who are pre-diabetic and diabetic. So we have to address that. There's a strong association between insulin resistance, heart disease, and cancer. So we can see there's 3 papers here. The first paper, insulin resistance and cardiovascular disease. It represents a major underlying abnormality driving cardiovascular disease. I didn't mention cholesterol. I didn't mention LDL. I'm mentioning insulin, which is a metabolic influencing factor. The next paper, looking at the insulin resistance correlation to hypertension. Abundant clinical evidence demonstrates a close linkage between insulin resistance and hypertension. That's again what we should be focusing on. And the increased risk of cancers. So it really is the core problem we should be focusing on. Insulin resistance increases pain. And here's a couple of papers. Insulin resistance directly associated with central pain in fibromyalgia and low back pain. Again, most doctors are not checking fasting insulin and its association to pain. So how do we check if we are healthy in our metabolism? So we have a range of tests here. You can go to your doctor and find out what those test markers are. Your fasting insulin should be below 120, HbA1c below 6.5%, blood pressure below 130/90, and a good waist-hip ratio. But the question to ask yourself is this: where does disease start? Does it start when you reach 120 milligrams per deciliter of glucose? No. When we look at this paper, normal fasting glucose and the risk of type 2 diabetes, the level stated was anything above 90 milligrams per deciliter had a much higher risk of developing type 2 diabetes. And yet, the conventional system in Hong Kong waits until you get to 120. So this is why a lot of people are becoming diabetic, because the medical system is not sensitive enough to intervene at an earlier stage. This is the problem. So in functional medicine, we do a lot further, a lot deeper checks. So the things which I've highlighted in asterisks, fasting insulin and the fatty liver test, are 2 very good indicators to find out if you're insulin resistant. And a continuous glucose monitor, which you wear on your arm, is also indicative. We can do additional tests like liver function markers, uric acid, triglycerides, and affiliated markers like looking at your LDL subfraction, your kidney function, and your inflammation. All of this builds up a very good picture of your metabolic health. So, with all this diabetes and metabolic disease going around, there must be a case for a new approach. And why is that? Well, the cost of diabetes management is only going up. And what we find here is that the longer you are a diabetic, the more costs are going to be piled onto the patient and the government who's paying for that patient to go up. And this has been a study based upon diabetic management in the United States. So that's only going to translate here over time. So is there an alternative? Yes, there is. And what we found is that the research in the United States and in the UK have demonstrated that ketogenic diets are very effective for not only controlling diabetes, but reversing diabetes. And here's a study done in 2018, the effect of carbohydrate restriction for people with diabetes. And it showed that when you restricted, there was a greater reduction in HbA1c at 3 months and at 6 months. So this is very significant for reversing diabetes. And here's an association with cardiovascular disease. The ketogenic diet and cardiovascular disease published just 2 years ago. And it showed a multifaceted effect in the prevention and treatment of cardiovascular disease, improving an anti-inflammatory and cardioprotective potential on the individual. And this is really important research to share. And here is the ketogenic diet influence on hypertension or high blood pressure. So what happened is it really lowered the brachial and central blood pressure levels in weight-related parameters. So this is an intervention to lower blood pressure in an effective way. And here's an association with chronic kidney disease, a paper which was published 2 years ago in the Journal of Clinical Kidney Journal. And this was a ketogenic metabolic therapy showing to be effective in reducing and reversing chronic kidney disease. And here we have a ketogenic diet for treating fatty liver disease. And 2 studies, one in 2020, one in 2007, both concluding that a ketogenic diet is an effective treatment for fatty liver. And this is very, very common in Hong Kong. So going back to the pioneer in the US, which applied this therapy, going back to 2016, was a company called Virta, which is a spin-out of a university. And this company applied a ketogenic diet for diabetics over a period of time with continuous glucose monitoring, with virtual health coaching, and supplemental electrolytes. And what they found was very, very good research to reverse the diabetes. And this is their model. They reversed obesity, they reversed prediabetes, and they reversed controlled type 2 diabetes. And all this research is all published. And this is the study they published here. This is a 1-year trial of 262 participants of people following a ketogenic diet. And what you see on the chart here is the blue bars are the effects of the Virta diet ketogenic therapy. And the gray bars are the control. And you can see the improvement in triglycerides, the VLDL, the ApoA1, a range of markers which are related to cardiovascular health and risk. And here we see an improvement on your systolic blood pressure and diastolic blood pressure. And here we have an improvement also on the LDLP, which is the LDL particles. And this is an improvement in atherogenic risk. So this is a very key research paper which prompted greater investigation on the benefits of ketogenic diet, not only for reversing diabetes, but for helping people with heart disease. But defining reversal of type 2 diabetes is important to get the clarity. And we can see that diabetes cannot be reversed or cured until you have long-term progress in the behavior. The behavior is critical. So you have to maintain that behavior of having glucose sustained at a low level for a long period of time. Then you can potentially say you've cured yourself of diabetes. So this is important to bear in mind. So I launched Newm 2 years ago in Hong Kong. And the goal was to reduce and reverse diabetes, hypertension in people who have these conditions and help people reduce their medications on those conditions using a ketogenic diet therapy approach. And this is important to be done in a safe manner. So the eligibility for the Newm program is important. We need to be defined as having either pre-diabetes, a high HbA1c over 5.7%, or a high glucose level, or being diabetic, or having a non-alcoholic fatty liver, or having high blood pressure, or having a BMI above 30%. These are the critical conditions to determine the suitability to a Newm program. And a Newm program consists of 3 key areas: the ketogenic diet with some key supplements, CGM monitoring, which is the glucose monitoring you wear on your arm to measure your glucose, and then the coaching, which is done through a registered dietitian in Hong Kong. And what we've designed in the Newm program is a Chinese ketogenic diet. So being respectful of the flavors of Asia and China, we need to integrate those flavors into the foods. Why? Because that is motivating for people to eat those foods if they taste what they're used to. Okay? It's critical. The cooking oils we use are avocado and olive oil. This is important. Reducing the saturated fat level does imply a better outcome when it comes to a ketogenic diet. We apportion the protein levels according to your weight. And as I say, we use the supplements to minimize the keto flu effect. And here we have some sample recipes from our program. So some of these recipes you may recognize. Kung Pao chicken, chicken curry, and Hunan prawn. And being married to a lady from China, from Shanghai, I'm trying to get some Shanghaise recipes as well. But that's going to take some time. But essentially, we're adding a lot of these recipes into our program so that people are going to be more compelled to eat the food and more compelled to stick to the diet and then have a better recovery for their diabetes. Now, moving on slightly, I just want to talk briefly about actually scanning your body for risk of disease. And you may have seen outside that we have the AirDoc device, which is actually measuring the retina at the back of your eye to determine your risk of disease. And this retinal scan, as you can see a picture on the screen here, is a window to your holistic health, giving insights into various diseases in the body, neurovascular disease in the brain, cardiovascular disease, eye disease, and ultimately endocrine diseases like diabetes. And it's very quick, just a 30-second scan of your eyes to give you a picture of your health. And it gives you this future health risk, as I say, of atherosclerosis, hypertension, diabetes, dementia, and eye disease. And once you know your risk, then you can intervene by taking various lifestyle measures, supplemental measures, or medical measures to reduce your risk. And I think that's it. Thank you very much.